I'm Dr. Deuce Roberson out of Henderson, North Carolina. Um, I started with Sleep Group Solutions probably about 5 years ago with a course with Rebecca. And because I had sleep apnea and I wanted to figure out how to treat it and feel better. I wanted to make a difference in my patients, and I wanted to save lives. I wanted folks to feel better. For me, I would fall asleep driving. I got diagnosed with anxiety about 6 years ago, and just out of the blue. I remember talking with my physician about it and telling him I was very tired all the time. It was no big deal to them. Never once was sleep mentioned. And so when I took Rebecca's course, obviously I found out the severity of my sleep apnea and how to treat it. At that point, I wasn't really sold yet on the pharyngometer and the rhinometer. So I went out just like I thought everybody else did and tried to make a device with the George's gauge. And so I brought my jaw out, maybe 60-65% max protrusion. And I wore it for a while with severe jaw pain. I wasn't feeling any better. So I found a dentist that was pretty close to me that had pharyngometer. So I went and I got on the pharyngometer. I actually took my device that I was wearing and got tested and found out that actually protruding me past end to end was kind of shutting my airway down. So we found the correct bite, which I think was 8 millimeters end to end, and I made another device and got my AHI down to a 1 and felt amazing. And so for me to be able to talk with my patients, know what they've gone through, know what they're dealing with, and know how I can actually help them is just a huge thing. So Sleep Group Solutions certainly has benefited my practice in that regard. The pharyngometer, for me, it takes away multiple appointments because you're pretty zeroed in on the right position with the pharyngometer. With the George's gauge or whatever else you use, it's an arbitrary position. And so you have to have multiple appointments to titrate a device. And with the pharyngometer, I'm pretty darn close where I want to be and where the final position of the mandible is. So there's no doubt in my mind the pharyngometer is the way to go. I was lucky to be invited to the Sleep Group Solutions VIP Mastermind experience this weekend. I'm sitting in this room full of extremely sharp individuals, and I'm wondering why I'm actually here. But these speakers and the dentists that are in there listening, they have so much knowledge on sleep that I'm trying to absorb it all. I can't wait to take this information back to my practice and start implementing it. So I'm really grateful to have had the opportunity to be here.